Since learning that LVHN and Jefferson were coming together, I felt a profound sense of this being a full circle moment for me. This feeling stems from my deep connection to Thomas Jefferson University, where I graduated. Throughout my medical education and career as a medical oncologist, the values instilled in me during my time at Jefferson, along with people who left an impression, have served as important guideposts for my life. However, my journey with Jefferson almost didn't happen. As a high school senior, I had been accepted at several schools and was strongly considering MIT. Despite scholarships, my parents were concerned about the costs, so I explored a pre-med and medical school program jointly offered by Jefferson and Penn State, a program still in place today, where at that time you could earn both your bachelor's and medical degrees in 5 years. I will never forget the day of my interview. At 17, my concerns were less about the interview and more about how I looked. I'd expressed my desire to my dad about getting a new suit, but he did not give in. He said, "Suresh, this isn't a modeling contest. They're picking you for your brains, not your beauty." That day, I learned that SAT scores and high school grades only got candidates in the door for the interview. What truly inspired me was discovering that Jefferson was actually looking for compassion, empathy, and caring in their future physicians. These values resonated with me and were ever present throughout my training. Finding my niche in medicine is certainly thanks to Jefferson. During clinical rotations, I was drawn to internal medicine because I enjoyed getting to know patients, diagnosing and treating them. My interest in pursuing oncology, and specifically melanoma care and research, were sparked by Dr. Michael Mastrangelo, a physician who's still on the Jefferson faculty today. I remember Dr. Mastrangelo as an optimist, especially in his tireless work on melanoma vaccines. When anticipating the future of melanoma care, he once told us, "We are going to crack the code on how to harness the immune system to beat cancer." 40 years later, we see the results of that optimism. Our program at Lehigh Valley Topper Cancer Institute has cured 50 stage 4 melanoma patients. That was an impossible dream back then, but Dr. Mastrangelo knew science would eventually make hope and cure possible. My training led me to 2 health systems, but it was an invitation to join Lehigh Valley Health Network that allowed me to build our melanoma program and become physician chief of Lehigh Valley Topper Cancer Institute. My Jefferson roots undoubtedly made this possible. Reflecting on the journey of my life, I feel immense love and gratitude for Jefferson. My training and career are thanks to Jefferson and a program that took a chance on a high school kid from York County. My inspiration to care for melanoma patients and research new ways to cure them is directly thanks to Jefferson. I believe the final arc of this circle was having the honor to hood my son, Jacob, when he graduated from Thomas Jefferson University last year and he embarked on a family medicine residency. However, now I have a chance to continue forging ahead in partnership with my medical school alma mater. That is truly the stuff of dreams and a full circle moment for me. I often think of my late father and how proud he would be to witness this moment too. Jefferson and LVHN are driven by a shared mission to help people in the communities we serve. Together, we will provide an even greater level of care, including more specialists and more innovative approaches to patient care. We will prioritize discovering new ways to care and cure. We truly are coming together for the future of healthcare, and it's right here in our hometown. As someone who knows how exceptional both organizations are, I'm excited to see the future that Jefferson and LVHN will forge together and how it'll positively impact the lives of generations to come. I can't wait to be part of this remarkable journey.